Hello guys, hello doctors, and welcome back to my channel again. After the introduction videos, and I'm going to start the subject wise topics, whatever I want to discuss. And first I'm going with the medicine. In the medicine, first of all, you're seeing the my channel links. You can scan these links and you can get back to my channel, and there the PDFs available and the video links will be available. And today I'm going to discuss mainly first about the connective tissue disorders. So let me write it first along with you guys, and you can even also take a notes. And after this video I'm going to share the PDFs in my description link. You can also download the PDF as well, and even if you want to take notes along with me, you can also take the notes. And I'm going to take this session very slowly so that everyone can understand it properly. So let me write along with you guys first. First, the heading is connective tissue disorders. Connective tissue disorders. So, under this heading, we are going to discuss mainly about and four important topics. First one is SLE. I hope you guys are most familiar with this name. You have listened it many times when you are in the medical colleges. And the second disorder is an rheumatoid arthritis. I hope you also know this name as well. And third one is a little bit new name, scleroderma. And the fourth name is this. I hope you guys know it, gout. So today I'm just going to cover only this one, and in next video I'm going to cover the next topic. That's how I'm going to cover everything. And today the first topic is SLE. That was systemic lupus erythematosus. Shortly known as SLE. So first let us discuss what is this new name SLE about. SLE is an autoimmune problem. Let's discuss a few lines and few minutes about an autoimmune problems. So what is an autoimmune? Autoimmune means in the name itself there was an something attacking our own immune system. Our body itself is attacking our own immune system and causing the problem. So in that autoimmune problems, there are four types of autoimmune problems: type 1, type 2 hypersensitivity, type 3 hypersensitivity, type 4 hypersensitivity. In that, SLE belongs to type 3 hypersensitivity. Type 3 hypersensitivity means it forms an immune complexes and damages our body and body organs and causes the disease. So let's write this, a few topics, few points about this. First, SLE. This SLE is an autoimmune problem. Autoimmune means our own body is attacking our immune system. It belongs to type 3 hypersensitivity. Type 3 hypersensitivity is immune complex mediated. I hope you guys know there are four types of hypersensitivities. This belongs to third type of hypersensitivity. This third type of hypersensitivity is immune complex mediated. I hope you guys taking notes along with me. And as compared to the males and females, who will be more affected? Whoever carries an X, more X chromosomes, they are most affected. Means females are most affected than the males and more affected, and worst prognosis in females when compared to the males. So let's write this one as well. As we can see, as compared to the males and females ratio, males and females ratio is 1:9, means 9 females are affecting when compared to males in a 10 out of ratio. Means let's consider if a if a male is an Klinefelter syndrome, suffering with the Klinefelter syndrome, so his chromosomes are 47XXY. This is Klinefelter syndrome. In males, see here, you have 2 X chromosomes are there. Means this guy has worse prognosis. And compare this along with 45XO. Can you tell me this name? What this syndrome? I'm just giving you a 30 seconds of time. Can you just tell me and can you just recall yourself? What was this? This is Turner syndrome. In Turner syndrome, there was only one X chromosome when compared to the Klinefelter syndrome. That's why this has a little bit better prognosis when compared to Klinefelter. But both of them have a bad prognosis, but when compared to Klinefelter syndrome, Turner syndrome has a better prognosis. Overall, females are more affected. Females has a bad prognosis. That's what I mean to say. So, let's write one more point about this. Prognosis of SLE it depends upon number of X chromosomes. I hope guys you understand the concept clearly, and it belongs to HLA-DR3. It belongs to HLA-DR3. So this is a small introduction about this bad disease SLE. So let's discuss along with me guys. First, SLE is an autoimmune problem. It is type 3 hypersensitivity. It is immune complex mediated, and in the SLE, females are more affected than the males, and in that too, in Klinefelter syndrome, there are 2 X chromosomes. That's why it has a worst prognosis when compared to Turner syndrome. Let's remember, Turner syndrome has 45XO, and the prognosis of SLE depends upon the X chromosomes, as I said you before, and SLE belongs to HLA-DR3. And let's discuss clinical features of SLE, like how by seeing the patient, what we can identify in the patient when patient walk into the clinic. So these are the clinical features, what the patient says, their complaints, these are the clinical features. So let's talk about a few lines about the clinical features. So in a clinical features, so let's remember the clinical features by the mnemonic that was PASS brain model. Let me write it for you guys. PASS, PASS brain model. This is the mnemonic. So let's go along with the letter by letter what this PASS brain model stands for. First, PASS, P. In this P, let's see what this P is. In SLE, it causes a photosensitivity, Means whenever a person exposed to the sunlight, there will be an rashes in the skin. This is an photosensitivity. So he is very sensitive to the light. I mean, I want to say this, he is very sensitive to the light. So photosensitivity. So let's elaborate with this one. Redness on skin when exposed to sunlight. And for this photosensitivity, this SLE forms an anti-Rho antibodies. This is very important. You try to remember this point. In photosensitivity, it forms anti-Rho antibodies to damage our body. So by forming the antibodies itself, it was attacking our body. So anti-Rho antibody. You just remember anti-Rho antibody. This is very important. And next is A. A stands for alopecia. Alopecia, I hope you guys know what is alopecia. Let's recall about this. Alopecia. Alopecia means hair loss. This SLE is also causing hair loss. And in our mnemonic, let's start with the other S. One S is there. That was S. That means serositis. Serositis means inflammation of a serosa. So this serosa is present in the pleura, that was called as pleuritis, and it also present in the pericardium, so that will cause pericarditis. In both of these conditions, patient complains of pain in the thorax region. Pain in thorax region. So how to differentiate? If patient comes to the clinic and he complains of pain in the thorax region, let's just imagine it was caused due to SLE. How to differentiate the pleuritis and from the pericarditis? So ask the patient to stop breathing, then a pain decreases, then there was no pericarditis, that was a pleuritis. Means while a patient or anyone, while we are just breathing, there was rubbing in the pleura. That's the reason it causes more pain. In the pleuritis, when the patient is breathing, that causes him a more pain. But if I ask the patient to stop the breathing, the pain will decrease. Means the patient is suffering with the pleuritis, not pericarditis. Pericarditis, irrespective of breathing, he is always having pain because heart is always pumping, right? We cannot stop the heartbeat. That's why the patient is always having the pain. This is how we will differentiate. Let us write it in a clear way so you can understand better. It's a little bit confusing. Still, I'll just write it so you can understand properly. So how to differentiate? So you ask the patient, PT means a patient, to stop breathing. If he stops breathing, if pain decreases, then we confirm it as pleuritis. So he don't have pericarditis. This is how we differentiate. So we have spent much more time on this small thing. So let's go to the next S. That was synovitis. Synovitis, you just recall, synovitis means this is something regarding a synovial fluid. Where was the synovial fluid present? Synovial fluid is present in a synovial space. It was present in the joints. So there was something, a problem related to the joints. So the patient complains of pain in the joints, or there was an mobility problems. A patient complains. That's why let's going to write this as a synovitis. In synovitis, in some problems, a patient complains of an pain in both hands. That's how the patient presents. We can see this condition as a rheumatoid arthritis. There was a symmetrical pain present, but in SLE, there was asymmetric pain is present, not the symmetric pain. In the SLE, there was no erosions, but in rheumatoid arthritis, there was erosions. That was erosive, but here this is non-erosive. This is how we differentiate SLE from the rheumatoid arthritis. In the question, if a examiner asks, there was an symmetric pain when the patient wake ups or get ups in the morning, and there was an erosions also present in the joints, and this clearly tells us about an rheumatoid arthritis. And whenever he talks about an kind of rash, I'll just come up with this rash and other stuff, and he just tells us about only if the only single joint was affected on the only one side, then we'll just think about SLE in our option. So this is how, if a examiner asks you in the question, so we are just going to differentiate it. So first, this is an synovitis. In synovitis, the pain is asymmetrical. The joints are affected is only on the one side. That this is what that means, and pain present, and this is also non-erosive. You just remember this word, non-erosive. So no erosions are present in this SLE. Non-erosive. And we just completed the PASS, PASS. So let's recall with this small thing along with me in a clear manner. So PASS, the first P stands for an photosensitivity. Photosensitivity means whenever the person goes into the sunlight, there was a redness present on the skin. That's what the photosensitivity mean. For that, it corresponds with the anti-Rho antibodies. And next is A. A stands for alopecia. Alopecia means a patient having a complaint of an hair loss. And next, S stands for serositis. Serositis means it is causing pleuritis and pericarditis. So how to differentiate the pleuritis and pericarditis? So the patient complains of pain in the thoracic region. So in between both of these conditions, how to differentiate? So let's ask the patient to stop breathing. If I ask the patient to stop breathing, the pain will decreases. Means it is related with the pleura. So that's why it is a pleuritis, not the pericarditis. So next, S is synovitis. There was a asymmetrical involvement and pain is present, and this is non-erosive. So this is basically involving the joints. So next we completed with the PASS, and next we are going with the brain, BRAIN. Let me write it for you. B. B stands for blood manifestations. It also affecting the blood as well. Let me write it. Blood manifestations. In blood manifestations, it also forms an antibodies against the RBCs, WBCs and platelets. So there was an pancytopenia. Pancytopenia means, so all the cells, all the blood cells are decreasing. Pan means a pan India movie, means the movie was released all over the world. That's how the pancytopenia means. The pan, whole class of cells, RBCs, WBCs and platelets are decreasing. So let me write it for you guys. Here RBCs and WBC and platelets. Everything is decreasing. So let me draw it for you. So there was an antibody forming against RBCs, WBCs and platelets. So this was damaging the RBCs, WBCs and platelets. So the all the count is decreasing. So the patient complains of an pancytopenia. Let me write it for you. Pancytopenia. So as you guys know about this, if RBC decreases, we will call it as autoimmune hemolytic anemia, and if WBCs decrease, we will call it as leukopenia. If platelets decrease, what we will call it as ITP, idiopathic thrombocytopenic purpura. I hope you guys know this full form. I am again repeating this one: idiopathic or autoimmune thrombocytopenic purpura. Purpura P. And the first we completed B. Next we are having, before going to R, where I am going to tell one more thing as well. So how to differentiate, let me write it for you first. So in differential diagnosis, how to differentiate the hereditary spherocytosis from an autoimmune hemolytic anemia. In differential diagnosis, let's differentiate hereditary spherocytosis from autoimmune idiopathic hemolytic anemia by doing the Coombs test. If Coombs test is positive, this is autoimmune hemolytic anemia. If Coombs test is negative, this is hereditary spherocytosis. This is how we are going to differentiate two of them by just doing the Coombs test. So remember guys, Coombs test is always positive in the IHA. Hereditary spherocytosis, it was negative. And next we are going for R. R means it also involves the kidneys as well. See, it also involves the kidneys. That was renal involvement. So there was renal manifestations as well. So I am just going to write renal involvement. In renal involvement, so as you know, there was one factor known as GFR. Glomerular filtration rate. I hope you guys know the full form. This will be decreasing much. If GFR is less than 30 ml per minute, so we can manage this patient by hemodialysis. So we are going to discuss this clearly in the renal chapter, but if GFR is less than 15, ml per minute, we are going to do renal transplant. So let's remember this guys. If GFR is less than 30 ml per minute, we are just going to do hemodialysis and manage the patient. If GFR is less than 15 ml per minute, we are just going for a renal transplant. And in this one, if this is affecting the kidneys, so this is also known as lupus nephritis. If renal involvement is there in SLE, this was called as lupus nephritis. In lupus nephritis, the patient has presenting with the features of hematuria and proteinuria. This is how the patient present. And there was a 6 class of regions. You need to remember this, guys. Let you just repeat with me so you can remember it as soon. So there was a 6 class of regions, 6 classes of lesions present. You just remember with this one with me. The first one is minimal change disease. I hope you guys know this one, familiar with this minimal change disease. So from this area question comes in SLE. Everything was a bit easy, so the examiner tries to twist you guys with this. And second one is mesangial lupus nephritis. And third one is focal lupus nephritis. And fourth one is diffuse lupus nephritis. And fifth one is membranous lupus nephritis. And sixth one is lupus sclerosing nephritis. You don't need to go into these names deeply, but you just try to remember the names. So you just try to repeat with me. The first one there was a change is minimal disease is there. Second one is mesangial. Third one is focal, up to particular focus. The disease is only up to particular focus. A fourth one is diffuse. It was affecting totally. That's how you need to remember. And fifth one is it is affecting the membranes as well. And sixth one is it was affecting, it was sclerosing. Sclerosing means an hardening. So you just remember with me: minimal change disease, mesangial lupus, focal lupus, diffuse lupus, membranous lupus, lupus sclerosing. Minimal change disease, mesangial lupus, focal lupus, diffuse lupus, membranous lupus, lupus sclerosing nephritis. This is how you need to remember. In this one, mainly you just try to focus on one thing, that was diffuse lupus nephritis. In diffuse lupus nephritis, you can see wide loop regions. Let me show you guys the image. I don't have it here, but I'm just going to add it from my files. So see, these are the, let me explain with my thing. This is an lupus nephritis. It was mainly seen with the diffuse lupus nephritis. This is an wide loop lesion. In wide loop lesion, you can also clearly see there was an membrane is present, right? The membrane is very thickened and it looks like wire. This is wire loop lesion. You just don't consider everything as a wire, but here the membrane where the arrow mark was there was a diffuse lupus nephritis. There was an wire loop lesion. You just remember the name, wire loop lesion. So in wire loop lesion also, let me paste it here. In wire loop lesion, this is inversely proportional to the prognosis. Means if how many wire loop lesions, if there was a more wire loop lesions, that means this is a bad prognosis. If the wire loop lesions are less, the patient has a good prognosis. This is what it means. And next we focuses on, we finish the R as well, B R finished, and next we are going to A. A is standing for A. A is standing for ANA antibodies. Sorry, I am using this color, ANA. ANA stands for anti nuclear antibodies. And next it stands for, next I comes, brain, I comes, BRA finished, and I comes. In I, we are just going to see the immunological findings. In immunological findings we are going to get many antibodies. These are very most important things in this topic, and you just need to remember everything. I'll just tell you the mnemonics, how to remember these things as easy. I hope you guys enjoying this session. Don't feel bored about these topics, and this is how I also learned these topics. And after I write and after I explain everything, I'll just revise the whole topic within less than 5 or 10 minutes. If you are bored with this whole topic as well, you can even watch that small topic, small discussion I'm going to discuss at the end of this session. It will be most and most helpful. And I also tell you the where the question comes from. You just need to remember only this one. That's good enough for the exam to go and get the good marks in the exams as well. So this is what I want to tell you in between. So let's focus on this immunological findings. I know guys this is a dry topic, so still I'm just going to spend the more time, but I hope, I expect one question from this topic. If it comes, and I just always tells the doctors, like a single mark is most important in the exams to score. That single mark makes a most changes in your lives. That's how it made for me as well. So I don't find detailed lectures of each topics in the YouTube as well. That's why I'm just going to start the topics step by step, and I'm going to clear all the doubts. If you have any doubts, if you have any problem with my lectures, you can even comment in the comment section below, so I can follow that manner, how to teach and how to explain and how to solve the doubts of my dear doctors who is watching my videos as well. So let's focus on this immunological findings first. In that immunological findings, let's find the what is most sensitive. In most sensitive, if examiner asks in the question what is the most sensitive antibody, so let's write it as ANA. ANA. ANA is anti-nuclear antibody. Just see it here. ANA is anti-nuclear antibody. Next, if examiner asks you about the most specific, the most specific is anti-Smith antibody. Anti-Smith. Anti-Smith is most specific. Anti-Smith is most specific. Anti-Smith is most specific. Anti-Smith antibody is most specific. If there was both, let's number this one as number 1 and number 2. If an examiner is not focusing about the most sensitive and most specific, but he is more focusing on the progression of the disease, like if he asks like how the disease is progressing, if he tells about the disease progression, so let's answer this as an anti-dsDNA antibody. So if the examiner asks the first one or second one, or there was a progression, if he talks about the progression of disease, how it was progressing, DS means a disease, progression of the disease. So let's answer this as anti-dsDNA antibodies. Anti-dsDNA. This is also an antibody, anti-dsDNA antibody. And the last one is, I hope this was not tough. and this is also not easy as well. If you read it for a first time, I hope you guys remember the most sensitive is ANA, most specific is anti-Smith. And if he asks about the progression of the disease, you just answer it as anti-dsDNA antibodies. And some diseases also, uh, some diseases also associated with the some drugs. If we take some drugs, there was a side effect for the drugs as a SLE. I hope you guys are reading a pharmacology. When you are just reading the pharmacology, some drugs having the side effects as a SLE. So now I am just telling the antibody that was responsible for this drug induced. Let me write it for you first. And this one was drug induced. Drug induced, the antibody name is antihistone antibody. Antihistone antibody. What are the drugs inducing this SLE? Let's know the drugs what are causing this SLE by the mnemonic as SHIP. SHIP. I hope you guys remember this mnemonic. Like many times I have used it in my college days as well. This is SHIP. The in that SHIP, let me use the other color so I can so you can remember it. SHIP is first drug is S stands for sulfonamide or sulfasalazine. S stands for sulfonamide or sulfasalazine. And H, what does the H stands for? You just recall your college days and you just tell me. H stands for, I'm just giving you a 10 seconds of time. H stands for, I'll just give you this drug is also used in the treatment of TB. I hope you guys remember this one. Yes, that is hydralazine. H stands for hydralazine. And what does the I stands for? This is also used in the TB treatment. ATT, you remember the ATT? Anti-tubercular therapy? This drug also used in the ATT. Most famous drug. I hope you guys remember it. I'm just giving you 10 seconds. You can answer me. This is isoniazid. And the last drug is, so don't feel guys, even if you don't answer, you can recall from this lecture and you can remember this topic and you can remember these SHIP drugs. This is most helpful even when you are reading the pharmacology session as well. So don't be disappointed even if you don't answer, no problem. Even when my lecturer ask the students, some people are answering the questions. Even if I don't answer the question as well, I don't think about it. I don't care about this thing. Still I can have in confidence that I can do this question comes in the exam. I remember this topic, so I can answer it in the exam. Not I don't need to answer in the class as well. So there was no problem for you. Even if you don't remember, you just remember it now. You can read it from now. Don't care about the college session. Even if you don't remember anything from the college, okay, leave it. Let's start it now. Let's remember everything from now. Just recall it from now. Revise it from now. Still you can clear your exams. That's how I cleared my exam. No problem. Yeah, let's focus on this thing again. I'm just trying to motivate you guys, and I know when I just discuss only the topic and you'll get bored, and even I feel get bored. So if I have a live session, I will be interacting with you guys, and it will be a funny session for me as well. But this is an video I'm just going to record and post it in the YouTube, and you guys watch it and you just tell me how the video was, and you can also comment in the comment section below. So how the video is. So let's focus on this one first. Procanamide. P stands for procanamide. So whenever your pharmacology faculty asks you what are the drugs causing SLE? You just need to remember SHIP. SHIP is causing SLE. SHIP is causing SLE. SHIP is causing SLE. You just repeat with me. SHIP is causing SLE. SHIP is causing SLE. SHIP is causing SLE. S stands for sulfonamide, H stands for hydrolazine, I stands for isoniazide, and P stands for procainamide. These are the drugs causing SLE. So we completed the drug induced SLE, and next we are coming to the neonatal lupus. So if the lupus occurs in the neonates, that's called as neonatal lupus. So there are some antibodies. This is causing the neonatal lupus as well. So we are just going to remember that names as well. Neonatal lupus. Don't worry, I am just recalling everything at the end of this session so you can remember everything as a story. Okay, no problem. Even if you don't remember now, when I recall everything, after that when you study after my lecture, you remember everything you will be remembering. Nothing to worry, even if you don't remember now. So a neonatal lupus, there wasn't two antibodies in neonatal lupus, that was anti-Ro. I hope you guys know these names: anti-Ro, anti-Ella antibodies. This is also known as SSA, and this one is SSB. These two are the antibodies for the neonatal lupus. If the examiner is asking about the neonate, there was a lupus causing the disease, SLE in the neonates, these two are the antibodies responsible for the disease. So that's what I am going to tell you. And next one is psychosis and CNS lupus. If patient complains of psychosis like symptoms, or there was something associated with the CNS, a lupus in the CNS, that was caused by anti-ribosomal P antibody. Let me write it for you guys. Anti-ribosomal P antibody. So let's remember it by the by seeing psychosis P and antibody P, anti-ribosomal P, psychosis P. This is how we are going to remember this one. So the next one is lupus cerebritis. Next one is lupus cerebritis. So this is something related with the cerebrum. There was an inflammation in the cerebrum. There was a lupus in the cerebrum that was causing cerebritis. So this was caused by anti-neuronal antibodies. This was caused by anti-neuronal antibodies. AB means antibody. So even we can also remember this one very easily by neuronal. Neuronal focuses mainly on the brain, and this is also cerebrum. Cerebrum is also brain. So this is how we are going to remember this one. And next one, we already know about this, photosensitivity. So even I have written this photosensitivity in the previously, but still I am going to write it for you guys. So we can recall this one for the second time. Photosensitivity. Photosensitivity is caused by what antibody? Do you remember this one? Photosensitivity is caused by, I have explained it at the first of my lecture. Photosensitivity is caused by anti-Ro antibody. Anti-Ro antibody. This is the antibody responsible for the photosensitivity. So I have also explained the photosensitivity. What does it mean? If a person stands in the sunlight, he is most sensitive for sunlight, and the sun exposed areas will become red, and this is how the patient presents. And in this way we are also seeing the malar rash. I am just coming for that one as well. So let's focus on this one first. And whenever the SLE is causing recurrent abortions, if SLE in the pregnant lady, it will definitely causes recurrent abortions. This recurrent abortions is due to some of the antibodies. There wasn't 3 antibodies names. You just need to just read about it, and don't need to specifically remember that, but you just read about it. So I'm just going to write it for you guys. Even don't be worry about by seeing all these antibodies names. Even I don't remember sometimes. Somehow when I forget it, I'll just open my book and I'll just recall the things, and so that's how I'm going to remember. But in the every topic and each topic, each antibody, each name, no one will ask about that. Whenever as a whole concept, you just remember what is SLE. It is an autoimmune and it belongs to HLA-DR3, and it affects mainly females. And you just need to remember the clinical features as a past brain model. That's good enough for you guys. And you just remember some antibodies and what was the most sensitive, what was most specific antibody. This is how you need to remember for the exams. And no one will ask you each and every point, as I'm just going for an I'm just going to explain the thing. They're just going to explain the topic. That's why I'm going to explain everything. So if a question comes from other topics also, even you can answer it very properly and you can score the marks. So the next one is recurrent abortions. So SLE is going to cause recurrent abortions. Recurrent is multiple abortions it is causing. So what are the antibodies responsible for the multiple abortions? I'm going to write it for you guys. The first one is anti-cardiolipin antibody, and second one is anti-beta 2 microglobin antibody, and third one is anti-phospholipid antibody. Just repeat with me: anti-cardiolipin antibody, anti-beta 2 microglobin antibody, anti-phospholipid antibody. Again repeat with me. The antibodies causing recurrent abortions is anti-cardiolipin antibodies, anti-beta 2 microglobin antibodies, anti-phospholipid antibodies. So again I am going to write it the same thing what I have repeated for 3 times. So even you can recall this very better, very much better. So recurrent abortions was caused by 3 antibodies: anti-cardiolipin antibodies, and next one is anti-beta 2 microglobulin antibody, and the third one is anti-phospholipid antibody. So these 3 are the antibodies causing recurrent abortions. So now we completed B, R, A, I also completed, and now we are just going to start N. In brain, last letter is N. In N stands for neurological manifestations. Neurological manifestations. In neurological manifestations, the first, it's going to cause psychosis. In SLE, patients complains of psychosis, and in other hand it also causes cerebritis. I hope you remember these 2 words from a previous just 1 minute back. I explained you. In psychosis, what was the antibody responsible for the neurological manifestations? P. P stands for P for P. I just said you how to remember the antibody: anti-ribosomal P. See, in the name itself, it has a P. Antibody. This is responsible for the psychosis. And in cerebritis, I said you to remember in such a way, the brain, there was neurons. So, brain neurons. So, the antibody is anti-neuronal antibody. So, antibody name is anti-neuronal antibody. So, this is responsible for the cerebritis in the SLE. So we completed the brain as well. First we completed PASS and next we completed BRAIN. Next we are going to enter the model MODEL. So what does this model stands for? In that the first letter is M. This is most famous. Whenever we say the SLE, everyone knows about this. Something rash around the face, something rash in the face. I hope you guys recall this. It's looks like something fly. What is that rash? You just tell me, what is that rash? Do you recall that rash? What is that rash? So I am going to write it for you. That is malar rash. What is that? Malar rash. Malar rash. It is also known as butterfly shaped rash. Butterfly rash. So I'm just going to show you how it looks like. See. Yes. This is the rash. See, I'm just going to show you. So you just see the shape of this rash. This is like a fly, right? If you just see this one, just focus on my laser. This looks like a rash. It is a butterfly shape. It was not affecting this area. It was sparing nasolabial folds. This is the area. This was sparing nasolabial folds. It was only affecting the fly shaped area. It was sparing nasolabial folds. So this rash, if someone asks you what is the kind of rash in the SLE, you just answer them as malar rash, which was sparing nasolabial folds. Malar rash, sparing means it was not involving, not affecting the nasolabial folds. It was not affecting nasolabial folds. So let me write it for you, the same thing what I have said now. It was sparing of nasolabial folds. So let me just write it. This is an malar rash. Let me write it for you. Malar rash. I'm just putting an arrow mark so you can remember it easily. Malar rash. And this malar rash is only seen in the acute cutaneous lupus. There was two types of lupus, cutaneous lupus. Acute, one is acute and other one is chronic. In acute lupus, we can only see a malar rash. In chronic lupus, we can see disc-shaped rash. That was different thing and this is a different. First we are just going to study only and rash, that was malar rash. You just remember it as malar is acute. Acute is malar rash. Acute is malar rash. Acute cutaneous lupus is malar rash. This is the same thing I am just going to write here. This malar rash is only seen with acute cutaneous lupus. M in model there was an O letter. Let's write it O. What does the O stands for? That was an oral ulcers. O stands for oral ulcers. So in a patient of SLE, we can see, not in the all patients, but in some patients we can see oral ulcers. These two, there are many ulcers are there. So the oral ulcers are numerous oral ulcers, and these ulcers are usually painful, but in SLE the ulcers are painless. Why these ulcers are painless means
the nerve in that area was affected by the antibodies in the SLE. That's why in the SLE patient there was an painless oral ulcers. Let's write this one. In SLE, the ulcers are painless. Painless oral ulcers. Why these ulcers are painless? Just I have said you, antibodies affects nerves. AB means antibodies affects nerves. That's why the ulcers are painless. And after we completing MO, next is D. So what does D stands for? Just now I said you about the other kind of rash, not the malar rash. There was an other kind of rash. What was that? That was disc shaped. Disc shaped. I hope you guys remember disc shaped rash. What was that? Discoid rash. Disc shaped rash. That is discoid rash. So let me write it. What does D stands for? In model, D stands for discoid rash. In discoid rash is seen in chronic cutaneous lupus. Discoid rash is seen in chronic cutaneous lupus, but malar rash is seen in acute cutaneous lupus. How to differentiate malar rash and discoid rash? Malar rash is butterfly shaped. It is sparing the nasolabial folds. It was seen in acute cutaneous lupus, but this discoid rash is disc shaped and there was a central scarring we can see, and this is seen in chronic cutaneous lupus. So this is the difference between the two rashes. Two rashes is seen in the same SLE disease. So let's write this one. Just a few topics what I just have said. That's what I'm just going to write. Oh, sorry. Discoid rash. It is seen in chronic cutaneous chronic cutaneous lupus. So I'm just going to show how the shape of this rash looks like. See, so this is rash. See, I'm just going to write this one. This you just see the rash how it is like disc shape, like round shape, disc round shaped. So we can see there was a central scarring is there. So you can see the white thing in the center. That was a scarring. We can see the discoid rash. I'm just writing it. Discoid rash with central scarring. So this is how this discoid rash looks like. So we finished the clinical features. After clinical features, so next heading is diagnostic criteria of the SLE. So how we are going to diagnose the SLE? That's how we are just going to discuss now. So let me write it first, and after that I am just going to explain you clearly how to diagnose the SLE. So what are the factors required? How many factors required to present or to diagnose it as an SLE? So let me write it first, and after that I am just going to explain you guys. The first is, the next heading is diagnostic criteria of SLE. So now whatever I am discussing, we have already discussed all the factors, like in a clinical manner, in an immunological manner. For immunological criteria, we are just focusing on the antibodies, and for clinical criteria we are focusing on the clinical features. First I am just going to write, the first one is clinical criteria. In clinical criteria we are having many things, so we just don't need to remember everything. You just need to remember one thing. I will just going to tell you guys now. In clinical criteria, there were many things. The first one is acute cutaneous lupus. When I am just going to write all this one, you are just trying to recall whatever I have explained you before. In acute cutaneous lupus, what we have seen is malar rash, and the second one is chronic cutaneous lupus. Chronic cutaneous lupus, what we have seen is discoid rash. Disc shaped rash, I have already explained you. What was the next one is oral ulcers. Oral ulcers, you just answer me, are they painful or painless? I am just giving you a 10 seconds. You just answer me, the oral ulcers are painful or painless in SLE. So oral ulcers, these are painless. Painless. And what was the next one is alopecia. Alopecia, it doesn't form a scar. In alopecia also, there was a scar forming alopecia, scarless alopecia is there. There was no scar in the SLE. We don't see any scar after alopecia. So this is non-scarring alopecia. Types of alopecias also you can study in the dermatology as well. So we don't go in this deep with the non-scarring or scaling alopecia. We are just going to write it, and when you are just trying to read, you just recollect it was non-scarring. It don't form scar. That's what it means. And after that, it also cause arthritis. This is not the new point for you guys. I just explained you about the synovitis. Synovitis means it also causing the arthritis. I also said you one more thing. So you just answer me, is that asymmetrical or non-symmetrical? I am just giving you 10 seconds. Is that asymmetrical or non-symmetrical? I am just giving you the hint also. It is only affecting only one side. Yes, yes, I know you guys remember it. It was non-symmetrical. It was non-symmetrical. I'm not going to write here, but it was non-symmetrical. And the next one is serositis. In serositis also, there was two types I have explained you previously. Do you guys remember it? It was pleuritis and pericarditis. So I already said you, a patient comes to the clinic with a complaint of an pain in the thoracic region. So how you are going to differentiate? That's what I explained you previously, and I'm just recalling you guys. I hope you remember everything. I hope you are genius, because you know the doctors. When you are studying as a doctors, we have a lot of brains, and we have an much IQ than other people, and we can remember most of the things most better than the other people. I know it, and that's how you also remember most of the things what I have explained you. And we are just coming to the topic again, that was renal manifestations. In renal manifestations, there was one most important image based question is there. Do you remember that? There was an wire loop lesions. Wire loop lesions. Wire loop lesions. This is the renal manifestation. And next one is neurological manifestations. In neurological manifestations, we can also see a psychosis is there and cerebritis is there. We already discussed these 2 points, and there was some specific antibodies for them. You just answer me, what was the antibody responsible for the psychosis? I'm just giving you 10 seconds, guys. What was the antibody responsible for psychosis? Psychosis P. P stands for P. Mnemonic is there. P. P for P. Anti-ribosomal P antibody. And for cerebritis, cerebrum is brain. Brain, there was neurons. So cerebritis, anti-neuronal antibodies. These two are the antibodies. You just remember it. I'm just recalling all the things again. And it also causing hemolytic anemia. In hemolytic anemia, I already explained you, this is a disease which was affecting RBCs, WBCs, platelets, all of the classes it was affecting. So there was a pancytopenia, there was pancytopenia, there was pancytopenia. And we also discussed one more point in the differential diagnosis, how to differentiate the hereditary spherocytosis from the IHA. By doing what test? By doing Coombs test. Coombs test is positive, always, always, always positive for IHA, and it was negative for hereditary spherocytosis. Just remember this point. It was only Coombs test is only positive for, it was only positive for IHA. It was negative for hereditary spherocytosis. And the next point is, just now I have said you, leukopenia. Leukopenia. And there was one more point also, thrombocytopenia. I hope you remember all these points. I have trust on you guys. I know you guys remember everything. That's why we are in the medical schools. That's why we are finishing everything. I know you remember. So just remember a small detail about thrombocytopenia. So if the platelets are less than 1 lakh, platelets are less than 1 lakh. So these all comes under clinical criteria. Let's just recall about one more criteria is also there, immunological criteria. In immunological criteria, we have antibody names. We are just going to recall this on the third time. After this, after whole topic also, I am just going to recall everything again for you within a 5 minutes. So you can recall everything and you are just going to learn this topic within this session. You don't even read, you don't even need to read this topic again. That's how I am just going to make each and every topic most clear, and you can recall everything within this class itself. Okay, and we are just coming to the topic, immunological criteria. The first one is ANA. ANA is anti-nuclear antibody, and the next antibody is anti-DNA antibodies, and next one is anti-Smith antibodies, anti-Smith antibody, and next one is anti-phospholipid antibody. So I am just going to ask you one small question, where we have seen the anti-phospholipid antibody. I hope you guys remember, I said in the pregnant ladies, recurrent abortions, there was 3 antibodies responsible for it. Anti-cardiolipin antibodies, anti-beta 2 microglobin antibodies, anti-phospholipid antibodies. Anti-phospholipid antibodies is seen in the recurrent abortions in the pregnant lady. And one more criteria is also there. There was low complement. So I hope you guys remember the complement system as well. Low complements, in that we have C3, C4, C5a. That's how we are just going to discuss that topics as well in the coming sessions. Right now you just remember just low complements are there, just low complements. You don't need to remember C3, C4 or CH50, but you just remember low complement system. And next one is direct Coombs test. Direct Coombs test. So this is a diagnostic criteria for the SLE. In whole this one, you don't need to remember everything, but you just try to remember at least one clinical criteria or one immunological criteria should be present to confirm it as an SLE. Means for diagnostic criteria, the requirement is greater than or equal to 4. Greater than or equal to 4 criteria is required to confirm an SLE. Means in clinical criteria, if there was an 3 factors, let's consider, I'm just using my laser, so we require a 4 or more than 4 criteria. In clinical criteria, there are many things are there in the clinical criteria. If we have 3, suppose if a patient is having malar rash, and if a patient is having oral ulcers, if a patient is having non-scarring alopecia, and so we are having 3 in clinical criteria, and at least we need to have one of them in the immunological criteria. If we do an antibody test, if the patient is having anti-Smith antibody, or if a patient is having anti-DNA antibody, if the patient is having anti-ANA antibody, means if one present here and 3 present from the clinical side, so totally it considers as an 4. So we can say the patient is suffering from SLE. Or else if patient don't have a most clinical manifestations, but if patient have more immunological criteria features, like if a patient is positive for DNA or if a patient is having ANA or anti-DNA antibodies or anti-Smith antibodies, all these 3 are present in the immunological criteria, and only one malar rash is present. So for this also the patient is having 4, so the criteria is enough. So the 4 diagnostic criteria is most important, and at least 4 factors should be present. So one from each is clinical, needs to be one criteria, one factor is present from clinical at least, and immunological criteria at least one factor should be present. Totally 4 should be present from both of them, like 3 from any of them or 1 from other one, or that's how it depends on the patient, and that's how the criteria comes to the SLE. So we are also done with the criteria as well. So let's come into the prognosis. Like I already told you guys, the worst prognosis is present in females. Females have worse prognosis when compared to males in SLE. It depends on the what chromosomes, X chromosomes or Y chromosomes. It depends on what chromosomes? Yeah, it depends on X chromosomes, not Y chromosomes. It depends on X chromosomes. So females have 2X, so the females are most affected, and females have bad prognosis. So let's write it. The prognosis, see, prognosis is poor prognosis. There was poor prognosis. In poor prognosis, the early cause of death is due to infections. In early stages, the cause of death is due to infections. But when it comes to the late stages of SLE, the cause of death is due to atherosclerosis. In late stages, the cause of death is due to atherosclerosis. So both of this is causing death. But in early stages, the cause of death is due to the cause of death is due to infections. But in late stages, the cause of death is due to atherosclerosis. So we are just coming to the end of this session, and finally, for everything we have a treatment, right? Whatever, if we don't know anything to do about disease, finally we are just going to give one and only mantra, that was in steroids. For autoimmune conditions, mostly we give steroids. Whenever you see autoimmune condition, if in question you don't know the exact answer, if you find in steroids, you can answer it as a steroids without seeing the options as well. So that's how we need to remember. If you don't know anything about disease, we don't know the treatment, what to do, we just give the steroids for the disease. So automatically it will decrease our immune system. So the patient feels better after giving the steroids. So let us write this one again. The treatment for these conditions is the steroids. But remember, in pregnancy we don't give steroids at all. But in pregnancy the drug of choice is hydrochloroquine. So let us write this one as well. In pregnancy, the drug of choice is DOC, means drug of choice. So the drug of choice is HCQ, hydrochloroquine. Drug of choice is hydrochloroquine. So that's all, guys. That's all. We finished the SLE topic. Now, what I am doing? I'm going to do is, whatever I said you, whatever I explained you, I'm just going to recall everything within 5 minutes. You just focus and stay with me. So even if you didn't focus for a total session, if you just listen for 5 minutes, whatever I am telling you, for sure you are going to get one question, 1 mark from SLE. Whatever the question comes from SLE, you are going to answer. Believe in yourself, don't lose the faith, and be confident about the topic whatever I am telling you. And first let us start. You just forget it, even if you don't remember anything whatever I just explained you, but try to recall. I just focus and stress some topics, some of the points, so you just try to recall. I'm just making it as a small story, like SLE, a small story. I'm just making it for each and every topic. I'm just going to do in the same way. So I'm just going to recall each topic at last for 5 minutes. You just try to focus on that 5 minutes. You can recall whole topic. No need to worry. You can answer that question. Whatever it comes from the SLE, you are going to answer. I'm damn sure. So let's start the SLE. What is SLE? SLE is an autoimmune problem. I'm just going to highlight with the highlighter. You can use this session as an revision session as well for the topic as well. The first is SLE. SLE is an autoimmune problem. What type of SLE? What type of an autoimmune problem? It belongs to type 3 hypersensitivity. And type 3 hypersensitivity means it is an immune complex mediated hypersensitivity. It was affecting mostly females when compared to males. And when we just see the Klinefelter syndrome, there was 2x. So the prognosis depends mostly on the X chromosomes. So that's why if you have more X, so there was a worse prognosis. So we finished that, and it belongs to HLA-DR3. And next we are coming to the clinical features. Clinical features we learned by the mnemonic is PAS brain model. In PAS brain model, P stands for photosensitivity. Whenever a person goes and stands in the sunlight, he complains of an redness or the face. That's the photosensitivity. The antibody responsible for photosensitivity is anti-Rho antibodies. And next A is alopecia. Alopecia means a hair loss. In alopecia also, it doesn't form scar. No non-scarring alopecia. And in the S stands for serositis. In serositis, there are of two types, that was a pleuritis and pericarditis. If a pleuritis, how to differentiate a pleuritis from the pericarditis? For the both of the conditions, a patient complains of pain in the thoracic region. If you ask the patient to take a breath, and if you ask the patient to stop breathing, sorry, I just tell you about to take a breath. No, ask the patient to stop breathing. If he stops breathing, the pain decreases, then that is a pleuritis. So he don't have pericarditis. So after that, there was one more S, that was sinusitis. So it is basically affecting the joints, but that too, it was not affecting the both joints. It is only affecting on one side. That's why I have written it as asymmetrical. Remember this, asymmetrical, and asymmetrical pain in the joints, and this is non-erosive. Remember this point as well. This is non-erosive. No erosions will be seen. And there was an we finished with the PAS, and next we are coming with the B. B for blood manifestations. It was causing the pancytopenia. if the RBC count decreases, autoimmune hemolytic anemia it causes, and WBC antibodies formed, it causes an leukopenia, and platelets decreases and it causes an ITP. And to differentiate, there was a differential diagnosis. How to differentiate the IHA from an hereditary spirocytosis? We just do the Coombs test. If the Coombs test is positive, then that was an IHA. If the Coombs test is negative, then that was for an hereditary spirocytosis. And next is R. So we completed B. Next is brain R. Next is renal involvement. In renal involvement, it is causing lupus nephritis. If we focuses on the GFR, if the GFR is less than 30, then we are just going to do hemodialysis and save the patient. If the GFR is less than 15, we are just going to do a renal transplant and saving the patients. In the lupus nephritis, the patient complains of an hematuria or proteinuria. There are often 6 classes of lesions in the lupus nephritis. There, first is minimal change disease, mesangial lupus nephritis, focal lupus nephritis, diffuse lupus nephritis, and membranous focal lupus nephritis, and lupus sclerosing nephritis. In diffuse lupus nephritis, there was an wire loop lesions. So I am going to show you the wire loop lesions. This is an wire loop lesions. Wire loop lesions means, remember, this is how the membrane is. This is an wire loop lesion. We can see it easily in the lupus nephritis. And just remember this point, wire loop lesions is seen in the diffuse lupus nephritis. It was seen in SLE. If more wire loop lesions are present, there was a bad prognosis, worse prognosis if there was more wire loop lesions. So next is A. A stands for ANA, anti-nuclear antibody. This is an antibody. ANA stands for anti-nuclear antibody. And next is, we finish the BRA, and next is I. In brain, I. I stands for immunological findings. In immunological findings, most, if the question asked and most sensitive, your answer is ANA. And if the most specific is anti-Smith. Anti-Smith is most specific. Most sensitive is ANA. Most sensitive is ANA. Most specific is anti-Smith. And if the question asks about the progression of the disease, you are just going to answer anti-dsDNA antibody. And SLE also caused by some of the drugs. We remember it by the mnemonic as SHIP drugs. SHIP drugs, S stands for sulfonamides or sulfosalazine, and H stands for hydrolazine, and I stands for isoniazide, and P is for procanamide. These are the drugs having a side effect as an SLE, and the antibody associated with this drug is antihistone antibody. And next one is neonatal lupus. In neonatal lupus, we just remember it as an anti-Ro, anti-La, Ro-La, Ro-La. Ro-La means neonates will cry. Ro-La, Ro-La, cry. In Hindi, we remember it as an neonates Ro-La, Ro-La, most crying is neonates. So Ro-La is an antibodies. In psychosis, P, we can remember it by P. P is seen in what antibodies? Ribosomal P. That's how we are going to remember the psychosis or CNS lupus. And lupus cerebritis, it is affecting the brain. So in brain there was neurons. So anti-neuronal antibodies. In photosensitivity, already we know, we have discussed this most of the times. So this is Rho antibodies, anti-Rho antibody, photosensitivity, anti-Rho antibodies. And in recurrent abortions, what we are going to learn about is 3 antibodies are there. Anti-cardiolipin antibody, anti-beta-2 microglobin antibody, anti-phospholipid antibody. Repeat with me: anti-cardiolipin antibody, anti-beta microglobin antibody, anti-phospholipid antibody. So again, we are just going to repeat antibodies names again, because these are the most important, where the question comes from. One of the question comes from like a wire loop lesions in that area, and next the question comes from the antibodies itself. So the most sensitive antibody is anti-nuclear antibody. ANA is most sensitive, anti-Smith is most specific, progression of disease is anti-dsDNA antibody, and the SHIP drugs causing SLE is what is the antibody associated with that is antihistone antibody. And neonatal lupus is Rola, crying. Most of the crying seen in the neonates. Rola. Rola is an antibody. And psychosis is anti-ribosomal antibody. Lupus cerebritis is brain, so neuronal antibodies. And photosensitivity, anti-Rho antibody. In recurrent abortions, we have 3 antibodies: anti-cardiolipin antibody, anti-beta 2 microglobulin antibody, anti-phospholipid antibody. So after that, we are just coming with the N. Last in brain, there was N. N stands for neurological manifestations. In neurological manifestations, one of them is psychosis and next one is cerebritis. In psychosis, we remember it, in many times we are remembering by P. P for P is for P for P. And next one is cerebritis. We remember it by anti-neuronal antibodies. And next one is PAS. We finish that PAS, PASS, brain we finished. And model, when we comes to the model, the first letter is M. In M, we know it by malar rash. Malar rash is also known as a butterfly rash. We can see it in the image. I have drawn it previously also. It was sparing the nasolabial folds. We don't see a rash in nasolabial folds. So that's why the sparing of nasolabial folds, the characteristic rash in the SLE is malar rash sparing the nasolabial folds. It was seen in the acute lupus, acute cutaneous lupus. And when we comes to the O, that was an oral ulcers. There are many number of oral ulcers. These oral ulcers, remember it as painless because the nerve was affected by the antibodies in the SLE. That's why these ulcers are painless. And other type of rash is also seen in the SLE. That was discoid rash. This is a discoid rash. This you can see it by the disc shape. This is a discoid rash, and there was a central scarring is also there. It was seen in the chronic cutaneous lupus. After that, how we diagnose the SLE? SLE is diagnosed by 4 criteria. If there was minimum or equal to or greater than 4 criteria is present, either 3 from clinical criteria or 1 from immunological criteria, any of them 4 is present, then we can confirm it as an SLE. I explained this clinical criteria very easily, and we also know we have I have explained it for many times, so you can recall it: acute cutaneous lupus, malar rash, chronic cutaneous lupus, discoid rash, oral ulcers, these are painless and non-scarring alopecia, arthritis, serositis, renal manifestations. In renal manifestations, there was a wide loop lesions and neurological manifestations and hemolytic anemia, leukopenia. These 3 is a pancytopenia. And in immunological criteria, ANA is, what is that ANA? ANA is most sensitive or most specific? You just answer me. ANA is most sensitive. ANA is most sensitive. Anti-Smith is most specific. So there was anti-phospholipid antibodies also there, and low complement system and direct Coombs test. Any of them 4 is present, like 1 from this is mandatory and 1 from this is mandatory. If the criteria is like 3 from this side or 1 from this side, then we can confirm it as an SLE. Okay. So after that, when we comes to the prognosis, it has a poor prognosis. If poor prognosis, early death is due to infections, and late death is due to atherosclerosis. And the treatment, if whatever we don't know anything about the disease, we are just going to give the steroids. It will heal. It will control the disease and make the patient life better. And in pregnancy, the steroids are contraindicated, so we are just going to give as hydrochloroquine. So this is all about this topic. I hope you guys like this video and like this concept. We just try to focus mainly on the things what I have stressed, mainly about the antibodies and wide loop lesions, and it was mainly seen in the females. And just to focus on the rash, there are 2 types of rash: discoid rash and malar rash. And there was oral ulcers also present, neurological manifestations, renal manifestations. And you just read one for 1 times after this video. You can remember this whole concept for your life. So be with me, guys, and I hope you like this video, you like the concept and how I am teaching. And if there are any suggestions for me, you can comment in the comment section below. And I'm very positive, take all the comments from you guys. And you can tell me, you can ask me whatever you want. and thank you very much for listening this video with your great patience, and I hope you like this session, and do follow for more interacting sessions with me. And I'm just going to share this PDF in my Telegram channel with the QR code what I have given in the starting of my session. You just scan that and you can get the PDFs available in that, and you can also follow my Instagram page as well. I'm going to share the useful stuff. At least you can get a one question that was very helpful in your life. Don't lose that one question. Yes, thank you very much. Bye bye.